Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're discussing breast cancer screening and risk factors for Breast Cancer Awareness Month. Next, we'll be talking about some common financial scams that target seniors with Gulf Winds Credit Union. Finally, we're discussing the risks of isolation among older adults and how community living can help combat loneliness. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. October is Breast Cancer Awareness Month. 1 in 8 women will develop breast cancer in their lifetime, and it's the most common malignancy in women today. Here today to discuss the diagnosis, prevention, and treatment of breast cancer is Vikki Jordan, Senior Manager of Imaging Services at Baptist Hospital. Thank you for joining me today, Vikki.
Thank you for having me, Emily.
So first of all, what is a mammogram and why should people get them?
Okay, so a mammogram is a very low dose x-ray that takes images of a patient's breast so that a very specialized doctor called a radiologist can read the mammogram and look for areas of concern that could be a breast cancer or something that we need to get checked out.
Okay, so how old do you have to be to get a mammogram?
So the recommendations by the American College of Radiology are for women at the age of 40 to have their first mammogram and then continue annually after that. Sometimes women who have high risk factors or maybe their mother or close family member had breast cancer, we will tell them to come earlier than that, but all of that should be discussed with your physician and they can direct you on the right path.
Okay, so there are some instances when people get them before they turn 40.
Yes, correct.
Gotcha. So I've heard that mammograms are painful. I know I was telling you I just got my first referral for one. I'm about to be 40. So can someone decide to have a breast ultrasound only instead of getting the mammogram?
It's a very great question. A lot of people ask that question. So first of all, set your mind at ease. On the mammogram, it only lasts for just a few seconds that you have to be in compression, and we try not to do it too tight, but it does help spread the tissue out so the doctor can see better. The mammography is actually the gold standard that we need to have. Breast ultrasound can detect things, but it's used in addition to mammography. So breast ultrasound has the capability to see masses that could be cystic or could be solid, but they don't have the ability to see something called microcalcifications. Microcalcifications are a very, very early form of breast cancer, and that is when we would like to catch it, is at the beginning so that we can treat it effectively and have a good long life with no other problems.
Okay, so best case scenario, we're not trying to get out of the mammogram. We got to get it.
Yes,
okay,
that's right.
Fine. So why do some people get breast cancer?
So although we don't really know the total reasons, we do know that it can be impacted by environmental situations. It does have an impact from our DNA. There are some things risk factors that we're out of control of. So like our age, our nationality, hereditary type things that are out of our control. There are some things that are in our control, such as like, are we living a busy lifestyle? Are we living a sedentary lifestyle? Do we drink? Do we smoke? All those type of factors factor in. So a lot of different things that we can do and can't do, but the mammogram is the biggest help that will help us find the cancer as early as possible if we have it.
And so to get those risk factors down, there are those lifestyle things, everything the doctor always tells us, good nutrition, staying active, those kinds of things. Don't smoke, don't drink too much.
Yes, absolutely.
All right, so tell me more about the risk factors. You mentioned some environmental things. What are some of those?
So some things that are environmental, or it could be sedentary lifestyle, we're not really exercising, alcohol consumption, poor diet, being overweight. Some patients have had radiation therapy to their chest for other reasons. That could be a cause of breast cancer. Taking hormones, can also be a cause. So that's always good to discuss all of those factors with your doctor so that they can help you through those processes if you have them going on.
And if someone finds out that they do have breast cancer, what is the next step?
So if someone finds out that they have breast cancer, at our hospital and probably a lot of others, we have breast health navigators and breast nurses that help the patient through the journey. So our radiologists would recommend the patient to go see an oncologist or a surgeon or a radiation specialist or all of the above, and then they would set the path for the patient. Another good thing to do is to get involved with a support group that has other ladies that are part of it that can help you with your journey.
And what are some of those pathways that you're talking about as far as, we know that people worry about having to get a mastectomy or something like that. What are some of those different pathways?
So from when I started in mammography about 30 years ago, mastectomies seemed to be more prevalent, and now there have been so many advances and so much of the time we are catching breast cancer so early. Patients can have just a lumpectomy and not have to have their whole breast removed. Okay. So I see that a lot more commonly now, but they also have options where some patients may need radiation or they may need chemotherapy, and sometimes people only need to have surgery. So all of these team of doctors, the oncologist, the radiologist, radiation oncologists all work together to determine what's the best path for the patient and what's the best course they should go on to help them into survivorship and hopefully no reoccurrence down the line.
So you definitely want to get that mammogram so that you catch it early, and then maybe you can get just the lumpectomy or some smaller action versus having maybe a full mastectomy, that kind of thing.
Yes, especially in the case where we can find things, what we talked about a little bit earlier, called microcalcifications. They're like so small, they're like a grain of sand, which is the beginning stage. That's where we want to catch it, because then we can act on it immediately and get it taken care of.
Yeah, grain of sand stage. Yeah. That's where we want to catch the breast cancer for sure. Anything else you want to share with people about just keeping up with their breast health and talking to their doctor about risk factors? What can people do? Yeah,
I think that scheduling your annual mammogram, sometimes we even have patients that will have their friends all get together and do it together, so you kind of have a little support group when you're going to get it done, so it's not nearly as frightening. I think definitely discussing your risk factors with your physician. If you have concerns, if you feel a lump, if you have something, speak up and tell your doctor about it. A lot of times people don't speak up, and then by the time they get to us, it's kind of later down the line. And if they had spoken up sooner, we probably could have done some things a little differently. So I think it's really important to see your physician and discuss all the things going on in your body with them, and that way they can make sure to get you on the right path as quickly as possible.
Perfect. Well, thanks for sharing that with us today.
Thank you.
Stay with us. We're learning about how to stay safe from scammers up next.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
Who are you?
Your lungs.
We're quite proud of you.
Even though you quit smoking years ago, you may be at risk for lung cancer.
But with the routine screening, you can detect it early when it's more curable.
Listen to your lungs. Learn more at savebythescan.org.
Financial scams targeting older adults are continually on the rise. Luckily, there are some good general tips to avoid becoming a victim and for spotting a scam before the fraudster can get access to money. Gulf Winds Credit Union is committed to financial literacy and helping to spot scams that may be in progress among their members. We've got Scott Slattery with Gulf Winds here to give us the facts about fraud and scams that target seniors. Thanks for joining me today.
Of course, thank you for having me. It's a pleasure to be here.
So tell us a little bit first about Gulf Winds Credit Union.
Yeah, so Gulf Winds Credit Union is a not-for-profit financial institution. We've been providing financial services for our members since 1954. We have 12 branches from Alabama to Pensacola to Tallahassee. And a really cool thing about us is we're owned by our members, which allows us to make our decisions with members first. And that results in low fees, low loan rates, and high deposit rates.
Awesome. Well, tell us about some of the types of financial scams that your staff and tellers come across.
Yeah, so it's an unfortunate reality that there's a lot of fraud and a lot of scams out there. So I'm really glad that you guys are talking about this right now. One of the biggest ones that we see are call spoofing. This is where a scammer will call you. They'll disguise their caller ID, making you think it's from a legitimate source, like your financial institution. Ultimately, their end goal is to try to get you to give them your verification code. I don't know if you've had to try to do that authentication and you get a text with a 6-digit number typically. Once you give that to them, it's all over. They have access to your account, they're gonna switch passwords, and they're gonna start stealing your money. So don't give them that number.
And it's hard when it looks like it's coming directly from Gulf Winds. Your caller ID says that.
It does. It's very scary. But I'll tell you this, there is not a financial institution in the world that will ask you for that. So no matter who it is, if they're asking you for it over the phone, it's not your financial institution.
And you can always hang up and then call your institution directly, right, to try to double check that kind of thing. So like if in doubt, hang up and call the number you have.
I'm glad you brought that up because I was going to mention that. But yes, absolutely. Your financial institution, they're not going to be upset. If you tell them you're nervous, if you tell them you're unsure, you want to call back, they're going to support you for that. Call spoofing isn't the only, scam that we see, of course, right? So there's gift card scams, there's romance scams, and there's sweepstakes scams. Sweepstakes, oh, you won $100,000. That's great, wonderful, right? So they want you to call them back. And then they're going to process your payment, your proceeds, but conveniently you have to pay for taxes up front, right? And so when you pay for those taxes, then lo and behold, you don't get those proceeds, right? Another one that you see a lot is you may have even actually had some of this yourself, where you either get a text or an email and it's a copy of a receipt saying thank you for your purchase, and it's multiple hundreds of dollars in a purchase, and you're like, whoa, I didn't make this purchase. What are you talking about? So you call them and they're, oh, let's give you a refund. Well, they try to give you a refund by depositing it into your account, right? And then they accidentally deposit too much, right? And then you have to give them gift cards for the difference. So it's sketchy, but we see that all the time as well.
And these new ones seem to be popping up all the time, it seems like.
It's a scary world with technology these days. There's an entire industry of scammers, and it's unfortunate, but they're very smart. They know how to use technology, and you never know what the future holds. I would just be on alert at all times. I'm not a trusting person, generally speaking, and if you're not expecting the call or the email, I wouldn't trust them.
And I think that's what they prey upon with older adults, where it's kind of not fully understanding technology or maybe feeling a little nervous, and they just get you to where you're scared, they're making a threat, they feel like there's some urgency, and you give them that information and then it's gone.
Well, and I would add to that too, is I think a lot of consumers, generally speaking, they're not always fully aware of all the different possibilities in the financial world. So they're almost even a little nervous or uncertain about things. And so if you can take advantage of somebody who doesn't really know that, they think it's fine, or they're like, well, this doesn't seem quite right, but I don't know any better, so they just kind of keep going along. And that's what happens a lot of times too.
So for caregivers of an older adult, what are the signs they can look out for that the loved one may be becoming the victim of a scam, or they may be targeted?
Yeah. So that's a sensitive one. I would say, generally speaking, anything that's out of the ordinary, right? So, erratic, financial transactions or unusual financial transactions. Are they making large cash withdrawals without with an unknown reason? Are they giving money, gift cards or cash to friends or a new friend, fiance type thing that you haven't ever met or heard of before? Things like that are pretty good signs
Those
to be
are the
looking
red
for.
flags.
Yeah.
So tell me a little bit about what Gulf Winds offers in terms of financial literacy, because I know you have done some for our clients at Council on Aging, and you do it out in the community as well.
Yeah, so we have certified financial counselors throughout the organization. So a lot of our retail team and our branches have a special certification and training that they can then help people with their financial literacy. So you can set up an appointment with one of our financial counselors, or as you've said, we've actually done different events with different local organizations to help spread the word and get some education out there.
Awesome. So tell me about some of the philanthropic efforts of Gulf Winds. I know you just took part in our Healthy Aging campaign and gave us $5,000 matching funds for healthy aging services.
Yeah. So community is really big for Gulf Winds, and so we like to support our community through the reputable nonprofit organizations, through sponsorships and donations, volunteer hours. We actually have a team building a house for Habitat right now, so we're always doing things like that. So there's a lot out there. And so we actually encourage employees throughout the organization to spend some of their personal time with an organization that means something to them.
And we've also had some volunteers from Gulf Winds over at our retreat adult daycare, so we very much appreciate all y'all.
Of course,
do for us.
yeah, we're glad to do that. Yeah, absolutely.
Well, thanks for being here today.
Yeah, absolutely. Thank you for having me. Appreciate it.
Next up, fending off loneliness among older adults. Stay tuned.
Do you want to meet a family with a transgender kid? Here we are. We love our kids unconditionally, and we will never stop fighting for them. Stand with us. Protect our families.
We are taught, you don't talk about your problems with nobody because you could get in trouble. And I've been through a lot. Anxiety, depression, sexual assault. When I decided to get help, my life changed. And the mental health box, that was one of the big tools. Accepting help means that we are allowing somebody to bless our life. It's freeing. We got stronger together. Love your mind.
I know my gun should be stored locked and unloaded. But what good is a gun if it's not prepared for use? So instead, I'm prepared for misuse. I'm prepared to stop arterial bleeding in 3 minutes. Less for kids, they bleed out faster. My son just shot himself. Hurry. Access to firearms triples your risk of death by suicide. But that's not the only way to misuse a gun.
I think I heard Mama.
Misuse can happen when you least expect. So being prepared means knowing the difference between CPR for adults and kids. Unintentional shootings happen every day.
There's been another deadly shooting in a local elementary school.
So that sense of safety my guns bring me
The gun he acquired from the family member's home.
can shatter in an instant.
The developing story will bring you more updates as they happen.
Store your gun securely, locked, unloaded, and away from ammo.
Who are you? Your lungs. Even though you quit smoking years ago, you may be at risk for lung cancer.
But with a routine screening, you can detect it early.
Learn more at savebythescan.org.
Two flashlights.
What's up, champ? Feel like you get taller every time I see you. Congratulations, Brandon.
Thank you.
Older adults are often at heightened risk for loneliness and isolation, which can exacerbate other physical and mental health conditions. While many seniors are hesitant about transitioning to community living, making the move can improve socialization among many other benefits. Joining me to tell us more is Courtney Benestante with Summer Vista Assisted Living. Thanks for being here.
Hi, Emily. Thank you so much for having me.
So first of all, tell me about Summer Vista and your role there.
Yes, my name is Courtney Benestante and I am the Director of Sales. We are a senior living and memory care community. We do have some folks that do move in specifically only for the social aspect of it though. We do follow the 5 C's golden rules, which is character, compassion, commitment, communication, and consistency.
That's good core values there. So tell us about the risks of social isolation and how can that pose a danger for older adults?
Well, it is true about 48 to 50% of seniors do experience social isolation. It does change to about 5 to 2% ratio once you hit the age of 85. I'm sorry, ladies, we do outnumber the men in that category.
Unfortunately.
Now, we do have a lot of social isolation that does hit the caregivers as well. It does hit about 50% of your caretakers as well. So, not only does it lead to social isolation with our seniors and our caretakers, but it has a profound effect on the body and the mind. So we try to mitigate that as much as possible.
Absolutely. So a lot of seniors tell their kids, don't ever put me in a home, I don't want to go. They're hesitant about making that transition because they value independence. So how would you address those concerns for the families that are looking at Summer Vista that are thinking about making that transition to an assisted living?
Certainly. So the first thing that I like to say is moving into an assisted living community is not about stripping away your independence. It's actually trying to help you keep it as long as possible. We're here to just help you as the need arises. We have a few people who actually move in only for the social aspect of it, or folks who come in directly out of a rehab and who are hopefully, again, going with our program and building up their physical therapy and hopefully be able to maybe get more independent than they thought they ever could be later in life.
Absolutely. I know our services with Counsel on Aging, a lot of them are to keep people in their home for as long as it's safe and possible. But if there comes a time when maybe they're able to live independently, but they don't drive anymore, so they're just not getting any visitors. And that may be the time when they could still live alone, but it would be beneficial of them to move into an assisted living where they have neighbors right next door, where there's help close by if they do need it. So we definitely see, that there's a time when maybe that transition is the right move. So describe for me what daily life looks like at Summer Vista. What are the sorts of activities or things people might have on their calendar if they're living there?
Absolutely. So usually every morning we start a very robust activity. So we start with calisthenics. We have it for every level, so if you are doing chair calisthenics, that's fine. We also have special balance bars for if you're 300 pounds and need a little extra assistance. We will go off property most days, or usually on Wednesdays our main outing, so we'll try to go someplace like shopping, Target, Walmart, something along those lines, or maybe go to a restaurant. Some of our local haunts are McGuire's and Five Sisters right across the street.
Nice.
We also bring a lot of stuff on property, so we may have live bands come in. We've had fire dancers, stilt walkers in our building before.
Wow.
We actually have the Montessori School of Pensacola directed right across the street from us. So we have a lot of our seniors will go over there and do story time, and a lot of their kids actually come to our community and do a lot of programs with us.
Oh, I love that intergenerational aspect. That's amazing. So it sounds like you can have a pretty busy social calendar there and you don't have to do kind of any of the work of planning and coordinating. You just, leave it up to Summer Vista.
Absolutely.
So any stories or examples of how community living has impacted a resident?
Got a couple of those. So around the holidays, we have the Pensacola Ice Flyers come in and they'll help our seniors decorate their Christmas trees. We have a bucket list program that we're currently doing. About 2 or 3 months ago, I was on a helicopter over the water with a 102-year-old.
Yes, awesome.
We have some gentlemen who do like to hunt, but they may not be able to do so these days. So we have 6 inflatable dinosaur costumes and a bunch of Nerf guns. So we create our own magic in the community.
Sure. We like to do things like that over at the retreat as well. So I love that, that other version of that type of activity that person is missing. So what advice would you give to caregivers concerned about a loved one who's becoming increasingly isolated but is resistant to making that change?
I tell everyone the exact same thing. Try to bring them into a community because everyone says the exact same thing. It's nothing at all like I was expecting. In all honesty, we've all seen the old movies where you get on the hallway and it's a bunch of doors and folks just go in there and never come out. Mm-hmm. That's not at all what it's like in a community. We are designed and built to be together as one. So the most advice I could say is come check us out, join us for a meal or an activity, and get to know some of our residents and see that it's all one community and we're not just some separated, isolated into a hospital. We're all one family.
That's awesome. So people can just come take a tour, come have a visit, and get a feel for what it's like before they make that commitment, maybe.
Absolutely. My door is always open, and we have many community activities. We actually have a trick-or-treat event coming up on October the 11th, if anyone would like to join, for the ages from 2 to 12. Oh. It'll be at 2 o'clock in the afternoon, but all the candy you can possibly imagine, so please, the more the merrier.
So you invite the community in as well, who aren't necessarily residents or family member of a resident?
Absolutely. We are actually very involved in the community. We are actually helping the Montessori Pensacola host their Falls Festival on October the 17th as well.
Wonderful. Well, thank you so much for this information.
Thank you very much for having me.
And thank you for watching. Until next time, enjoy life. You've earned it.